Hi everybody, my name is Allie Green. I'm an occupational therapist here at Methodist Fremont Health, and I have Ann Holtz with me. She's a nurse case manager for orthopedic patients, and this class is a video version of a class that we also hold in person for all of our patients that are having a total joint replacement. What we would like you to bring to the hospital when you have surgery is definitely a pair of sturdy shoes. They don't necessarily have to tie, but you also need to account for some possible swelling. You are able to bring whatever personal care items you would like. We have them here in the hospital, but if you want to bring your own things from home, that is perfectly okay. And the most important for personal items is at least 2 sets of very loose, comfortable clothing. We say that jeans are never loose enough, just because of the bandages and things that will be over your incision. This is especially important for those who have a hip replacement. Some of that swelling makes it really difficult for some of our patients to pull their clothes up over that incision and that dressing, so just keep that in mind. If you use a CPAP at home, please bring that with you to the hospital. And then a list of your home medications and their dose and how often that you take them. You do not need to bring the actual medication unless it's an eye drop or an inhaler. And then obviously your health insurance card, and you are able to bring your own walker if you would like. We have them here at the hospital, but if you would like yours specifically fit for you, you're welcome to bring it. We just ask that you don't bring it until you are up in your hospital room. It's kind of difficult to make the shuffle from the operating room to the hospital, so have somebody bring it up to the hospital room once you are finished with surgery. So we ask that you have a healthcare partner that's ready to assist you with things that you might need in the hospital or once you return to home. Right now in the hospital, we don't have visitor restrictions except that they are required to wear a mask while they're in the hospital with you. And really, we want them to just help you retain the information that's provided to you by the staff here at the hospital. You might be feeling a little groggy after surgery or tired, so we want them to help you know all of the information for when you go home. And then we want somebody to be able to be available at home if you would maybe need help getting dressed or changing those pesky TED hose, because those are pretty difficult. Just have somebody prepared to help you with those more difficult things at home. So to prepare for your surgery, we're asking you to do a couple of different things. You have an exercise program in the booklet that was provided to you by the orthopedic office. If you did not get one of those, we will provide you some contact information because we want you to start that exercise program now. No matter when your surgery is, we want you to get working on those exercises on both legs because the operated leg will have some weaknesses because of what they're doing to the muscles, and then your non-operated leg is going to have to kind of do double duty. So we want to make sure that they're both extra strong. And then get your home ready. So make sure that you have a good shower set up. Maybe that would include a shower chair or a tub bench if you have somebody that you could maybe borrow one of those from. And then make sure that your toilet area is all cleared so that you have ample room to get your walker maneuvered around your toilet. And then all of your throw rugs need to be picked up at home in the bathroom and in the rest of your house, because when you have a surgery, because of the pain and just the lack of movement that you normally have, you're not able to lift your toes up as high as you normally do, and so it's very easy to catch a toe and end up stumbling over a rug. We ask that if you live alone or if you're not going to have help all of the time, I would have a plan in place for meals and laundry and those things that might be a little more difficult for a couple of weeks. And then a surgical nurse is going to contact you 1 to 2 days prior to surgery just to finalize exactly what time that you need to be at the hospital, exactly what medications you need to take the day of surgery. And then another important thing is to know your schedule for your Hibiclens showering, and also make a plan for having clean bedding right before surgery and once you get home. That's important for preventing infection. The morning of surgery, the surgical team asks that you take that HIPAA-cleansed shower and make sure that you brush your teeth. You'll kind of see a theme of making sure that your body and your mouth are very clean throughout this entire surgical process. And then you'll check into the hospital 2 hours prior to the surgery time, and that phone call with the surgical nurse will help review exactly what time to be at the hospital. Then they'll have you sign a blood consent form just in case you would happen to need blood during or after surgery. They'll start an IV, and then you might have a Foley catheter to drain your bladder, just depending on the type of anesthesia that they're going to use. The surgery is roughly an hour and a half to 2 hours long, just completely depends on your case and the severity. So for a knee surgery, they're taking out the end of your big thigh bone and then the shin bone, and they're just creating a new knee joint in both of those. And for a hip, they're taking out they're inserting a new piece into the socket of the pelvis and then creating a new ball component in the top of the femur, which is the big thigh bone. This is an idea of what our patient rooms look like up in the hospital. We remodeled several years ago, so we have very beautiful patient rooms. You can see obviously the hospital bed that you'll come up from surgery on, and then there's a bedside chair off to the right, so the therapy team will help you get up to that chair several times during your hospitalization. We want to keep you up out of bed as much as we can. And then obviously there's a computer for the nurses to chart your vital signs and your medications, things of that sort. And then way off to the right outside of the picture is your own personal bathroom that's completely accessible, like shower and toilet with all of the grab bars, everything to make it handicap accessible. After surgery, when you come up from the operating room, we call it post-op day 0, and we expect you to have pain. It's just described as feeling more of a surgical type of pain instead of the pain that you're normally used to experiencing. So you can see in the picture at the bottom right, that is what a post-op knee patient looks like the day after surgery. That is not swelling. Your leg will not be that big underneath the dressing. That is just packed really tightly with cotton, and it helps prevent swelling and blood clots. And then there's a little drain behind that knee, and Dr. Buck uses that on some of his patients to help get rid of some of the extra fluid and blood. But therapy will definitely start the day of surgery as long as you're out of surgery late morning or early afternoon. And we'll start by getting you up and moving and putting on some clothes if you would like. But we will not be using a bedpan like I mentioned earlier. We want you up out of bed as much as we can. That helps prevent many different negative health effects. So we can get you up to the toilet, or maybe we will use the commode if we need to. And then we want you to eat all of your meals up in the chair. It helps prevent pneumonia. If you are eating meals in bed, you're just sitting in a very poor position, and it's easier to aspirate some of that food. Again, you'll see a theme. We want you up, walking and moving as much as possible within reason, because it just helps prevent a bunch of adverse health events. And be ready to have continuous vital signs taken for several hours after surgery. We just have to really closely monitor blood pressures and a couple of vital signs to make sure that everything's a-okay. The day after surgery is called post-op day number 1. So both OT and PT, occupational therapy and physical therapy, will see you 1 and maybe 2 times each that day, depending on how you're progressing and what time you might leave the hospital. Not everybody leaves on post-op day 1, but several do. If you have stairs to get into your house, that will definitely need to be done with physical therapy prior to you leaving. We don't want to send you home if you have stairs and not know how to do them. And then we'll definitely make sure that you have a clean mouth and clean body on that day. So we will get you up to the sink to brush your teeth, maybe wipe down or possibly shower if you would like to do that. And then that really large ACE bandage wrap that was on the leg for knee patients, that's going to be taken off early morning the day after surgery. When you're ready to discharge from the hospital, just be prepared that all of the paperwork and phone calls and appointments, they can take several hours. So it would be best to be prepared for an afternoon discharge, just because the surgeon comes in at 7 in the morning or whenever they round. That doesn't necessarily mean that you'll be ready to go right away. So be prepared that it might take a while, but you should have a ride that's prepared to pick you up as early as 10. So if you're doing well and everything's ready to go, we could have you out the door anytime between 10 and later in the afternoon. So have a ride ready, and make sure that your ride is a vehicle that is adequate for you to get into. So try to avoid a super short or really tall vehicle if you can. If that's all you have, we can definitely make anything work. But if you have a choice, try to have a vehicle available that is about hip height to get into the passenger seat. And then plan on wearing your TED hose, which are those tight white socks. Plan on wearing those until your first follow-up appointment, which is approximately 10 to 14 days after your surgery. And that appointment is actually scheduled when you schedule your surgery. So if you don't know what date and time that appointment is, it will be on your discharge paperwork from the hospital. And then plan on using your walker at home until your therapist tells you not to, or the surgeon tells you that you don't have to anymore. It's kind of dangerous, or it can impair your outcomes if you're not using it as long as you're supposed to. And the amazing thing about the dressings that we're currently using, it's called Aquacel foam. You can shower right over the top of them. You don't have to plan on covering your dressing in order to shower. They just ask that you don't submerge your incision, so no baths or pools. We have 2 different types of therapy here in the hospital, and they might overlap a little bit, but we're focusing on very different things. So occupational therapy, when they come to see you, we'll be making sure that you know how to take care of yourself once you get home after the hospital. So that includes things like getting dressed, taking a shower, making sure you can get to the toilet, standing at the sink long enough to brush your teeth. And then physical therapy is making sure that you can get around safely, like walking, doing your exercises, making sure you can get up the stairs, just to make sure that once you are home, that you're capable of getting around safely without any falls or any adverse events like that. Pain management is a question that we get quite a bit, and we will obviously do everything that we can to help prevent any pain from getting too high. So we use things like medications, ice, position changes, movement or walking, which seems kind of counterintuitive if you're having pain that you would want to get up and walk on that new joint. But actually we hear quite the opposite, that really helps people relax and kind of bring that pain down to a reasonable level. So if you want to try that, definitely let the nurse or therapist know that you feel like you need to move a little bit. And then we can also try elevation to help bring that pain down. We say that everybody is at a risk for falls after surgery, no matter your age, just because of the pain medications, the anesthesia. So we're going to do everything we can to prevent that from happening. So we will use a safety belt on every patient, like to get to the bathroom or to go for walks. And then we require that everybody use non-skid footwear, which could be our beautiful yellow socks that we use in the hospital, or if you would rather wear your shoes, you definitely can do that. We will always have you use your walker, and we ask that you don't get up on your own. We will definitely give you all the privacy that you need to go to the bathroom and everything. We just don't want you really going from point A to point B without somebody with you, just in case. Pneumonia is a concern after surgery, so many of the things that we've already talked about help prevent pneumonia, but you will also get a visit from respiratory therapy to teach you how to use an incentive spirometer, and that just helps really open your lungs up since you're not moving around as much as you would be normally. And then they ask that you cough and take deep breaths every hour. And again, be as active as possible. We want you up and moving. That really helps your lungs fill and expand and prevent that pneumonia from happening. Constipation is also a risk with any surgery because of the pain medications and you're just not moving as much as normal. So being active, drinking fluids, and then taking the stool softeners that they have prescribed will all help get your bowels moving back to a normal pace. Blood clots are another risk with any of these surgeries. So I included that picture on the right because that is the back of your knee. So you can see there's blood vessels and nerves that run back there. And so if we have anything in the back of your knee, it can put you at a risk for a blood clot because it kind of pinches off those blood vessels and makes blood back up into your calf. So we want to avoid any pillows or big recliner cushions right in the back of your knee. The other thing that we use to prevent blood clots is being up and moving. The calf muscle kind of helps get blood moving better. And then the TED hose, those tight socks that you wear, help prevent blood clots. When you initially come up from surgery before you're moving, you'll have an air pump device on your lower legs that helps get that blood flow going. And then the physician will prescribe a blood thinner based on what your risk factors are. So it might be different for somebody who already takes a blood thinner versus somebody who might not. And the surgeons just ask that if you have any shortness of breath or chest pain after you go home, to make sure to call 911 and then call your surgeon if you feel like you have some new leg pain or swelling or redness in your calf. Infection is also a risk anytime that you're being opened up with surgery. So you'll be given antibiotics both pre and post-operatively to help reduce that. They want you to use that Hibiclens or antimicrobial soap as they tell you to. They ask that you don't shave your legs for 48 hours prior to surgery, just in case you would happen to nick something. They don't want that to be an open space for bacteria to enter. They would like you to remove nail polish from your toes and your fingers. That just makes it easier for bacteria to hide, and it also is easier to get an oxygen reading off of your finger if you don't have nail polish. And then any dental work that you are planning on doing should be done either 3 weeks prior to or 6 weeks post-op. We all know that dental floss and things at the dentist office can draw blood, and that means that your gums are open to bacteria. So we just rather reduce that risk and not do any of those dental things close to surgery. And then keep your incision and just yourself in general really clean and dry. Try to make sure that your house is clean, your bedding is clean. Any run-ins that you have with something that might be dirty just puts you at a risk for having some sort of bacteria on your skin. If you're a smoker, it's recommended that you stop smoking prior to surgery, as that puts you at increased risk for infection. And again, just keep yourself as clean as possible. And they recommend clean sheets and clean pajamas the night before surgery. And that also includes your spouse. So if you're sleeping with a spouse the night prior to surgery, you could be clean, but if your spouse is getting into bed dirty, then that puts you at an increased risk for infection as well. There are some precautions to be aware of after surgery. If you're having a hip replacement, you'll wake up from surgery with like a foam wedge or a pillow in between your legs because they don't want your toes pointing significantly inward or outward. But for several weeks after surgery, depending on the patient, they don't want you to bend at your waist more than 90 degrees. So if you're sitting in a chair, you cannot bend forward any further. And if you're standing upright, you can't bend over any more than 90 degrees. That you cannot cross your legs. They want you to keep your thighs like shoulder distance apart and do not turn your feet inward. Therapy will really work with you on this in the hospital because this really creates a problem when you go to get dressed or put shoes on if you can't bend over and you can't turn your feet inward. So we'll work on solutions for that. And then for a total knee replacement, it's pretty easy, and that is no kneeling, which you probably won't feel like doing anyway. After surgery, your surgeon would like a phone call if you have pain that's completely out of control and not controlled by your pain medications, if you have pain or swelling in your calf or leg, if you have unrelieved nausea or vomiting, a fever, if you have redness or drainage at the incision site, or if that drainage smells foul, or if you have blood that in your stool, urine, sputum, or a bloody nose, and that's if you're taking a blood thinner. And then our hospital has an in-house pharmacy that offers a discharge medication service. And what that means is they're not necessarily asking to take your normal day-to-day medications, but what they're offering is to fill the medications that you're only going to get one of, like a blood thinner or your pain medications. And the reason that that's convenient is because they are located literally right at the bottom of the elevator that you will use to leave the hospital. So instead of having to stop at a pharmacy and wait in the car for your prescription to be filled or rely on somebody to go get that for you, you can just do it right on your way out of the hospital. And if you have any questions about medications or blood thinners, pain medications while you're in the hospital, we have pharmacists on site that will be able to visit with you and answer those questions.
So this is Anne, the nurse case manager that's going to either talk to you by phone call before surgery or once you get here to the hospital, and we want to talk about all of your discharge options. We want to try to get you home. The biggest thing, and you will do so much better, is in your own home. And when you're home, of course, like Allie talked about a lot, is we want someone there with you. So home health care can come to your house. They would come, 3 times a week, but depending on what kind of entities we get you, whether it's nursing, PT, and OT. So they might be there each day for an hour or so, but most of the time it's just 3 times a week. Outpatient therapy is where you're going to get your best therapy, but of course you won't be able to drive for the first couple weeks, so you would need to have a ride, and that is at a therapy of your choice. So you would just need to let me know, and I can make your first appointment. The last thing we talk about is a skilled nursing home, but that's a difficult subject because nowadays your total hip and your total knee procedures are done at what we call an outpatient status. And being in an outpatient status means that you might not qualify to go to a skilled nursing home for after your surgery. There's many different factors, and I can talk to you more about this while you're in the hospital. But you will definitely be seeing me either later the day of surgery or the next day, and I will help you take care of all of this before you go home. So if you have any questions about anything that you saw in this PowerPoint, you can call me at 402-941-7363. And of course, listed is my email, and I check that daily as well.